Wanted to make a quick video to talk to you about one of my biggest pet peeves, which is suction tubing, or better yet, dirty suction tubing. As a nurse, you're going to be suctioning patients quite a bit orally. In the ICU, you'll be suctioning them endotracheally as well when they're on mechanical ventilation. And your ARDS patients and patients with pneumonia tend to create quite a bit of tenacious secretions, especially your smokers. One of the biggest problems is your suction tubing getting full of that real thick, gunky, bloody secretion, and that stuff can really cause some problems with your tubing itself. One, first and foremost, as that secretion starts to dry up and harden, it's going to impede the wall suction's ability to get a really good suction and to remove secretions. Is also going to cause a bit of resistance, but it also looks really nasty and disgusting when you have family members walk into a room or other colleagues walk in and you see a whole bunch of nasty secretions in your suction tubing. There's an easy way to mitigate this and to not run into these problems, and I'm going to show you. This is a sink. This is the foot pedal. If you press on this, water comes out of the sink. This is an empty cup. Put water in the cup. Alright, so we have a little applesauce in our suction tubing to simulate some secretions. It's pretty simple. Take your yank hour and dunk it in the water after you suction your patient. Or unhook the tubing from your inline suctioning and dunk it in the water. And just like that, in less than 10 seconds, we have really nice, clean, presentable suction tubing. What you just witnessed is something I like to call PFM, otherwise known as pure fucking magic. It's one of the simplest and most overlooked things that I see at the bedside. If you see somebody with dirty suction tubing, doesn't mean that they're not a good nurse and they're not doing their job, because they are. They're suctioning their patient, but it just doesn't look so nice. It's just one of those things. It looks a lot nicer when it's more presentable, it's clean, when family members come in, or even the patient, if they're awake and they see the tubing laying on them. It's not so nice to have this gunked up, gross, bloody, brown, green, secretions caked inside a tubing, and you're going to save yourself a lot of trouble by getting rid of that and not impeding the flow of suction when you're going to need it. Just take a couple seconds, take your time, and just make your patient and tubing look presentable. It's pretty simple.